That time of year, the sniffles, the sore throat, maybe a little fever, some of the symptoms that have hundreds of people rushing to an emergency room. But is it a cold, the flu, or maybe something worse? Christina Gonzalez checked in with a doctor who has seen it all for answers.
Just relax.
If your child has cold symptoms that just don't seem to go away, they're not alone, says this specialist on pediatrics and adolescent medicine.
I have been seeing viruses that are causing a little higher fever, somewhat more like flu-like symptoms.
The start of fall usually means the start of the cold season, but this is being described as the worst cold they can remember, and they remember.
It was horrible.
My son got sick so far, yeah. I think it's earlier for some strange reason.
Check out some of the calls coming into the Kids and Teens Medical Group in Pasadena.
I have gotten people worried about if these symptoms could be Ebola. However, they have not traveled to West Africa. They have not come into contact with anyone who's traveled into West Africa. So I've done my share of reassurance.
Parents are really worried about Ebola? Well, we asked in the waiting room.
I think a lot of parents have fears in general, and I think this year, with all this fear of Ebola and different types of meningitis and such like that, yeah, parents are a little more fearful.
So, is it a cold or flu or something worse? Seems to be a real question which doctors can answer, starting with the symptoms.
A regular cold, you may have some runny nose, you could have a little bit of sneezing and congestion, but a cold is mainly upper respiratory. So it doesn't go down into your lower respiratory tract, and it stays mainly kind of in your head and your face area.
There may even be a slight fever for a couple of days. The flu, that's a whole other story.
A flu, you will get higher fevers, you will be fatigued, you may have chills, you feel really run down with the flu. And the fevers can last more than those first 2 to 3 days with the cold. So with the flu, your fevers may last sometimes going into a week, sometimes going into a few weeks.
We have cold and flu. How about the something worse, like meningitis?
Just like any other viral infection, viral meningitis will cause fevers and fatigue and those types of symptoms. But if it's bacterial meningitis, you have a pretty significant stiff neck and you're quite ill with bacterial meningitis.
Dr. Desilva recommends a vaccine for bacterial meningitis.
Once you turn 11, you're eligible for the first meningitis vaccine, and then once you turn 16, you're eligible for the booster vaccine.
The other vaccine she is adamant about is the flu vaccine. Ask everyone in the clinic's waiting office.
We actually everyone got it this season.
Do you get it every year?
I usually do, yes.
Have you had your flu shot?
Yeah.
Doctors say Ebola is scary, but right now, worry about the flu.
It's staggering. The number of hospitalizations, every year there are over 20,000 hospitalizations in children. In 2012, it was up to like 68,000 deaths from influenza.
Shots are already available. I'm Christina Gonzalez, Fox 11 News.